Hi, this is Dr. David Greene, CEO of the Florida Pain Network, where we connect those in pain with pain management clinics throughout the state. The topic today is 5 key points for facet arthritis treatment. Well, the first thing to look at is, what is a facet? A facet is a joint called the facet joint. This is the back of your spine. You have your coccyx, the sacrum, and then the lumbar vertebrae. These are the facet joints. These tiny little thumbnail-sized joints that are on both sides, right and left, of your spine all the way up and down. They're about the size of a thumbnail, and they have cartilage just like your hip or your knee joint, and they're prone to arthritis. So as you reach your 40s, 50s, 60s, it can become a real issue with back pain, and it can become chronic. So the first key point is that even though it's a thumbnail-sized joint, it can cause major league pain because it's not just related to the size. You move your spine a lot with every step or bend or twist that you take, okay? So every joint is used, and if one of those is arthritic and painful, every movement can cause pain, okay? Now the 1B, that was 1A. 1B is that if you have facet arthritis in one joint in your lower back, most likely you have it in multiple, okay? Sorry to be the harbinger of bad news on that, but that's the case, by and large. Second key point with facet arthritis is that surgery solely for facet arthritis is a terrible idea. They've been trying for many years to develop a facet joint replacement, an artificial joint replacement such as you have for the hip or the knee. It doesn't exist. It's not good enough. Okay, it's a complicated joint, it's small, there's not a lot of fixation points around it. It doesn't have the capability like you would for a total knee or hip to be a ball and socket, or, with the case of the knee, have the metallic component and the plastic in the middle. It just doesn't have that. It's just a complicated joint as far as its movement goes, and there has not been success with that yet. So surgery for that is just a terrible idea because it's a spinal fusion that would be involved. And then you transfer those stresses up and down. And what, you have facet arthritis at multiple levels? Are you just going to fuse them all? Doesn't make sense, okay? So key point number 3 is about a medial branch block. Now, medial branch block is an injection by a pain management doctor. It's outpatient. It involves injecting numbing medicine and steroid around the joint where the nerve supply comes in, and it can cause those nerve stimuli to stop so that you get pain relief. And if you get pain relief, it can tell you that joint was the cause of the person's pain. But what a lot of people don't realize, and this is the key point, is that injection can provide 3 months on average of pain relief. That is very impressive, okay? So a lot of people don't realize that. They think, oh, it's going to be good for a day or 2 or a week. No, the average study shows 3 months. Very good. Now, next key point is number 4, and that is that a radio frequency ablation procedure is often done when a medial branch block pain relief wears off. If it worked and then it wore off, radio frequency ablation heats up those joints, the area around it. It can provide 12 to 18 months of consistent pain relief, even more possibly. But that is very impressive. There's not a lot of pain management procedures right now that have such a low risk profile and a high reward. So radio frequency ablation, very impressive. The 5th key point is also on radio frequency ablation, that if you have the procedure, it works well, pain relief wears off after 12, 18 months. Studies show that if you have a repeat radio frequency ablation, the pain relief is just as good, by and large, as the first time that you had it. So don't necessarily fret, because the studies show that if you have it done again, you'll be good to go. Okay? So there's a lot of information on our website at floridapainnetwork.com. If you need a pain doctor, just go on our website and click on I Need a Pain Doctor and put your zip code in. It'll show you the ones that are closest to you. And if you need further assistance, just call us directly at 877-877-8556. I'm Dr. David Greene, CEO of the Florida Pain Network. Your pain stops here.